Well, good afternoon and welcome to the annual public meeting and annual members meeting of Lincolnshire Partnership NHS Foundation Trust. My name is Paul Devlin and I'm the Trust Chair, and I'm going to be steering us through the meeting today. We've titled this year's event Moving On from COVID-19 in recognition of the impact of the pandemic on the last year and indeed its ongoing impact. Today is going to be a chance for us to reflect on some of our achievements, including the fantastic response to the pandemic from our staff and volunteers. The board and I have been absolutely overwhelmed with the incredible professional and patient-focused response to COVID-19 all our staff and volunteers have shown. And that recognition is shared by our Council of Governors too. I also want to acknowledge the impact of COVID-19 on staff and volunteers themselves, not only professionally, but also personally. I know some have lost loved ones, have lost friends, and indeed lost colleagues to COVID-19. My heart goes out to you. So without further ado, I'll move to our first video on some reflections on the year and our achievements. So, looking over the year, we were re-inspected by the Care Quality Commission, the CQC, just as the COVID pandemic hit. So actually our well-led review was postponed. It was actually due about a week after we went into lockdown. But the CQC was able to assess the trust based on much of the information and data provided, and also on doing a site visit a little earlier in the year. And the trust continues to be rated good overall and outstanding for well led, which I think is a really strong achievement and a great reflection for all of our staff. There's been a lot of new investment in local mental health services, learning disability and autism services. And I'm really pleased to say that we were able to get £7 million of national investment into the Lincolnshire system to transform community mental health services for people with severe mental illness. It's a very welcome additional investment for us. Our community transformation includes investment in a new approach to community mental health services, as well as pilots of new community rehabilitation services and services for people with personality difficulties and complex trauma. That's initially in the Lincoln and Gainsborough areas, but with an ambition to extend across the whole county. As well, we've been able to secure additional support for Lincoln's rough sleeper community, a particular community affected really difficultly by the COVID crisis. And as a trust, we're committed to eradicating dormitory accommodation across our inpatient wards. And we were able to secure and deliver an investment of £4 million to provide individual bedrooms and improve privacy and dignity on our Brant ward. We've also had a welcome boost for our crisis services, which has enabled us to develop a 24/7 mental health helpline and 24/7 mental health liaison in local accident and emergency departments, both of which are services that we have known were well needed across Lincolnshire. The helpline has been particularly invaluable during the pandemic, enabling people to access support and advice over the phone during these unprecedented times. And we've been able to develop our Criminal Justice Liaison and Diversion Service in conjunction with Lincolnshire's Action Trust. This means providing early mental health support and intervention for people as they come to the attention of the criminal justice system. And we've developed a new autism support network. It's funded by Lincolnshire County Council and NHS Lincolnshire clinical commissioning groups. Unfortunately, the groups haven't quite been able to make the impact hoped for, as much of their activity had been planned just as the pandemic hit. But we're hoping to get back up and running very, very soon. Mental health support teams and Healthy Minds will be invaluable in supporting schools and pupils following the pandemic as they restart their term this month. And it's important that we seek to continue that support in our schools. We've piloted a new home treatment model for young people, which has helped prevent hospital admission. And we've expanded our perinatal mental health service, our individual placement and support service, and also our veterans support services. All really, really positive developments for us. We had to temporarily close the Ash Villa unit, our inpatient unit for children and young people. We had some real challenges around our staffing levels and recruitment, but the new home treatment model that we developed is absolutely preventing young people being admitted to the hospital, and I think we've been able to bring a very good result out of the challenging situation. We've brought additional investment to be able to develop our transforming care agenda for people with a learning disability, and also supporting those people with a diagnosis of autism. That's been a welcome development, something that we've been looking at for a number of years. So, as with previous years, our teams have been recognised in many, many ways through various national and local awards, and it's always good to see that the work of our staff being recognised in this way. So just to highlight a few of these. Our Steps to Change service achieved the Royal College of Psychiatry accreditation programme for psychological therapist service, and 6 of our community mental health teams have now achieved the Royal College of Psychiatry accreditation programme for community mental health services. Our inpatient services and crisis teams were awarded Carers Quality Awards from everyone. Individual Placement and Support Employment Service was awarded the Centre of Excellence status from the Centre for Mental Health. And our community mental health teams achieved the 2nd star from the Triangle of Care, a really important project ensuring that we focus in on the carers of those who use our services. Lindsay Khan, our team manager for our Veterans Service Tills, was shortlisted in the English Veterans Award in 2019 in Role Model of the Year category, and won the British Journal of Nursing Award for Mental Health Nurse of the Year, a fantastic achievement and a really welcome recognition of Lindsay and her work. Laura Forster, our Senior Data Warehouse Developer, was shortlisted in the Excellence in Women's IT Awards in the Rising Star of the Year category, and also in the Unsung Hero Awards 2020 in the IT and Digital category. Healthy Minds Lincolnshire was shortlisted in the Children and Young People Now Awards in the Mental Health and Wellbeing category. Dr. Jazz Full won Care Coordination Association Good Practice Award 2019 in Innovation to Support Service Development. The LPFT Staff Recognition Programme was shortlisted in the Best Employer for Staff Recognition category in the Nursing Times Workforce Awards. And for the 9th year running, Lincolnshire Partnership Trust was ranked in Stonewall's Workplace Equality Index, narrowly missing out on the top 100. So a fantastic year. Those are just some of the awards and recognition that we've seen of our people during the year, and I'm delighted that we've been able to highlight some of these for you. So I do want to say a big thank you. This has been an absolutely unprecedented year for the NHS and for this trust, and I'm so proud of the way that our staff and volunteers and those who use our services too have been able to step up in such difficult, strange and indeed scary times. We would not have been able to do what we've done without that dedicated team of staff and volunteers, without support from our members, from our Council of Governors and indeed my colleagues on the Board of Directors. I'd also like to thank our staff side representatives who have worked tirelessly with us to enable us to transform services. Our local MPs, local government and other health and care stakeholders, and of course our third sector partners. And we usually each year hold a long service awards ceremony. It's an opportunity for us to recognise volunteers who have given long service to the Trust. Now, obviously, in the current time, given social distancing measures and the caution around COVID, we have had to do this in a different way. I'm delighted to say that we did have a long service awards ceremony, which we conduct in a very careful way to make sure that we retain social distancing. And we were able to recognise a number of volunteers, all of whom had given 6 years service to the Trust. So I would give a great shout out to Millie Allinson, Desiree and Joseph Applewhite, to Helen Bussey, to Christine Cooper, and to Carol Granger and Lincoln, her dog, who also received an award and a badge. They all have given 6 years service. So 36 years service is fantastic. And it was an absolute delight to meet with them and to hear a little bit about what fantastic work they've done as volunteers for us.